The other industry that spawned at this time in AI is actually AI consulting. And there are more consultants than you can find anywhere that are now experts in AI and will help you implement. So I'm going to talk about where the rubber hits the road and the challenges that you actually have once you make the decision to implement any kind of AI solution in healthcare. And a lot of it is going to seem very mundane, but when you're dealing with hospitals and healthcare institutions, and we heard earlier how inefficient they are and all the barriers in terms of implementing value-based care, well, implementing any AI solution is actually a significant challenge in healthcare. A little background into the hospital I run. I run University Hospital at Downstate. That's a hospital in central Brooklyn. We have a socioeconomically disadvantaged population. 81% of our patients are funded by government insurance, either Medicaid, 41%, or Medicare, 40%, and almost all our Medicare patients are on Medicare Advantage, so it's Medicare managed care. Additionally, 80% of our patients are either African American or Afro-Caribbean. So definitely a socioeconomically disadvantaged population, and one that deals with a lot of social determinants of health issues. We have adopted digital health and AI as a strategic initiative. We are pretty early in the process, so just how we think about it, and I borrowed this from Vinita Argawala, who's one of the principals at A16Z, which is one of the Andreessen Horowitz venture arms. So I look at implementing AI and digital solutions pretty much the way she's outlined here. And if you look at the y-axis is harder for AI, goes up, harder for humans on the x-axis, and then you have a 2x2 matrix in terms of hard in AI, easy in humans, etc. So what she points at as the place to avoid, obviously, things that are easy for humans, but hard for AI. And a simple example is if you wanted to use autonomous vehicles to transport patients between healthcare settings. Obviously, a human could do that pretty simply. It'd be very complicated for artificial intelligence to do that. What she recommends, and where I sort of think about this, is starting with things that are easy for humans, but also easy for AI. And what do I mean by that? So I mean things like pre-authorization, credentialing of physicians and providers. Those kind of things are easy for humans, but it's a repetitive task, it's boring, and potentially by using AI, which it's pretty easy for AI to do this, you can take humans out of the equation and potentially increase efficiency in getting these things done. So first off, I decided to tackle what sounds like a simple problem, and that's post-discharge calls between the hospital and the patient. And the reason to do that is twofold. First reason is that by calling and making sure the patient has their medications, their follow-up appointments, and understands all their instructions, you potentially can reduce readmissions. And if you know about value-based payment, there is value-based payment based on reducing readmissions. The second reason is we are evaluated on patient satisfaction surveys. And we have a low rate of return of those satisfaction surveys, and we felt that by improving and doing these phone calls, we could potentially improve our patient satisfaction return rate. So we had a nurse that was making these calls to the patients, and they were making phone calls. Turns out they were only able to get in touch with about 40% of our patients. So it wasn't making a big impact, and we were using 2 nurses who were NPs to make these phone calls. So a significant cost, a limited return. So we thought we could solve a simple problem. By the way, this is both our AI-generated images, and you can tell that if you look at the hand here, it's clearly not a normal person's hand. So just a little side note in terms of using generative AI to help you generate slides and images on slides. So we decided to partner with a company called Memora Health and to use chatbots to replace the nurses and making these calls. Thought pretty simple, easily done. Chatbots are pretty ubiquitous nowadays, and we would use these chatbots in order to contact our patients and replace our nurses. Here's where the problems start. So as I mentioned, we are in a socioeconomically disadvantaged area, and believe it or not, a significant proportion of our patients still have landlines. Another significant proportion have burner phones, meaning they change their numbers frequently, so what's in the electronic medical record may not actually reflect the number of the phone they're currently using. So that was an initial problem. Additionally, initially, we were dealing with a population that about 20 to 30% do not speak or read English as their primary language. So we had to figure out how to get the context and the chatbot specifically into a second language, and in this case, Creole, Haitian Creole. The other change, and this is something you really need to think about in any implementation, we changed the responsible party and who was going to benefit from the technological solution. So before, we had nurses making the phone calls, and now we were shifting responsibility to the registrars to make sure, and I'll show you in a second, what we had to do to make sure the patients were willing to sign up to be contacted by the chatbot. And by doing this, shifting the responsibility, we were unburdening the nursing, but now we were putting an additional burden on our registrar. So that becomes a significant barrier to being able to implement successfully. Then our lawyers got involved. And our lawyers did not like the fact that a third party was contacting our patient. So we went back on this significantly, and our lawyers made us get consent from the patients. So at first I asked them, can we just have, this is the general consent for treatment when anyone goes into any healthcare facility, they have to sign it. I asked initially if we could add an opt-out, right? So if you don't want to be contacted, sign here. And it's been shown opt-outs are a lot easier to implement than opt-ins. Our lawyers insisted that we put an opt-in, and here you can see the language, and then the patient had to accept. A lot of our patients come through the emergency room. Registration is a little more haphazard. Having time to explain this can be difficult. So this presented a significant barrier. So as a result, we needed to come up with scripts for our registrars as well as our nurses on the floor, so if they missed it in the emergency room or at admission, our nurses could then do it when the patients were on the floor or at the time of discharge. So we had to create a script for our registrars. We had to create a separate nursing script to convince the patients to accept the service. And finally, we had to create a script at discharge and discharge instructions and tell the patients where they would be and how they would be contacted. So it's taken us about 6 months from the time we actually got the contract signed And for those of you who have tried to deal with healthcare and hospitals, you know the sales cycle is long to begin with. So you add another 6 months before you can implement. We're in the implementation phase, and this has proven to be a significant barrier in getting patients signed up. We've gone back and forth with the company and possible other ways of getting this done, but we still are having problems getting patients signed up. So based on our experience with this specific implementation, as well as other implementations we've been doing in digital health, we've created, as part of our strategic initiative, a framework for how we go about implementing or identifying AI solutions. So the first thing, and this is in general, it's not necessarily specific for the case I mentioned in terms of looking at simple solutions like a chatbot, but the first thing, is there a data source available to train the algorithm if you're building an algorithm? Second thing, is the data annotated, and if not, how would you accomplish the annotation? Third, is your data structured or unstructured? And then, based on if it's structured or unstructured, do you have a need for natural language processing? This is an issue that's come up in some of the other talks, and that's the issue of bias in the data set. So you want to make sure you minimize bias in the data set so you're not perpetuating disparities and bias as you implement an AI solution. An important question is, should you use an off-the-shelf or a custom model in your specific instance? And that's really based on how precise you need to be. So obviously, if you need precision to the 99.9%, you're most likely going to have to create some kind of custom model, whereas if you're dealing with a use case that doesn't require that level of specificity and accuracy, you can use something off the shelf. An important thing to consider, and when you're trying to roll this out and getting buy-in across the institution, is how do you ensure that there's trust in the model that you're using or that you've built? And then, really specific to the case that I talked about, are three things. Who are the stakeholders that would be using the outputs? Who is going to get more work? And who is going to be relieved of work, potentially from the solution? How will the stakeholders use the information in the model or change the way they're implementing and providing information to your customers? And finally, the most important thing, how will the model be deployed or implemented? So in conclusion, I really sincerely believe, and I think most of the people in this room and online believe, that digital health and AI are going to transform how we deliver healthcare in this country, hopefully reducing costs, increasing efficiency, and improving outcomes. It's important to realize that there are significant challenges once an institution or an organization decides to implement a solution, and you need to think through the possibilities before you start the implementation. So thanks to HitLab and Stan Kanowski for inviting me, and it's a privilege to be here this morning.